Hi, my name's Chris Raven. I'm a local Bendite since 1992. Throughout my life, I've had a lot of opportunity to sample different types of dental care. Broke my front teeth as a child, and it's created this compound effect, if you say, ultimately leading to an implant. And in the community here, I work as a mortgage originator, so I help people find the right loan for their home. And as you know, moving combined with a home loan is really stressful. And I feel like I differentiate myself on service. And I understand the power of service in my business. And this has ultimately led me to my relationship with Dr. Smith here at Denture Artistry. And the important thing to note is I've sampled a lot of dental care. And I have a habit of maxing out my insurance rather quickly. So not only does the payment structure of what I'm doing matter, which is something that differentiates this office because they don't, well, I'll let them talk about it, but essentially it costs me less to do more. And I ended up coming to Dr. Smith from a family recommendation from my sister, who is a difficult patient. And if she says this guy can do it, then that'll get me at least in the front door. But what I really liked was the amount of service I received. I had a issue with my front tooth. I felt like it was broken, but it wasn't mobile, and it was causing me some pain, and an x-ray wasn't a good enough tool to image the crack. So Dr. Smith had me come in, and they used their, what is it, a 3D scanner, essentially? It's like, yeah, it was really showed that I had a crack, or maybe it was a shadow. It was still hard to determine. But Dr. Smith gave me a cell number and said, look, when you're on your trip, which I was going to, if I needed anything, I could call him. And of course, Murphy's Law stepped in. My tooth fractured all the way through. I ended up having an infection, so I needed to contact Dr. Smith. He was able to call me some antibiotics in, and we were able to start treating the injury. And that ultimately led to an implant on my front tooth. And it was a really difficult implant because of all the stuff I had been through. It required many, many more steps to get the correct result that we wanted. And the best part is throughout all of these multiple steps and office visits, I was never made to feel like I was a difficult patient, even though I knew I was, not mainly because of my attitude, but just the level of difficulty present in this restructuring of my front teeth. So I have two crowns, one crown and one implant for my front teeth, and we were able to spend the time to get me happy with my smile again. And I'm here because I really appreciate what he does, and I believe in how he helps people in the community.